get some provincial reaction now. Andrew Furey is the Premier of Newfoundland and Labrador. He joins us. We go from one Newfoundlander to another. Premier Furey, as you just heard from David, 10-year deal expected with money flowing as soon as the next budget. How does that prospect of a 10-year agreement sit with you?
Well, I think it could be beneficial. I mean, as David said, the devil's in the details, but it does allow and afford for provinces to make that long-term plan. The plan that we have in Newfoundland and Labrador, or the Health Accord NL, is a 10-year accord. It's one that looks towards modernizing a healthcare system, one that's really stuck in the 1960s. I mean, we haven't had a modernization of the system that is afforded, this opportunity is afforded to us right now. So I'm interested to see what the quantum looks like, what the timeframes look like, and how that fits for us in Newfoundland and Labrador specifically with respect to modernizing our system.
Help us understand what is really happening here. Like the Prime Minister rather has talked about this as a working meeting. Is it a negotiation if you're only going to have 2 hours tomorrow with the Prime Minister, or how are you viewing what this conversation is actually going to be when everybody's around the same table?
Well, we all have the same understanding, I think, that's in the public sphere right now, which is there appears to be a section of this proposal. I haven't seen it, but that looks like it'll be dedicated towards the CHT, and a section that's dedicated towards bilateral agreements in which we can unlock the ability to look at value for specific shared priorities within jurisdictions. So, you know, what's important for me in Newfoundland and Labrador may not be what's important for Saskatchewan or British Columbia. And those bilateral agreements, I think, are really important. I think that that's where the negotiations will really take place. The framework, the concept, one of increasing the CHT and having bilateral agreements and the flexibility and affordability to have those discussions is certainly something that Newfoundland and Labrador can support, depending on, of course, on what it looks like tomorrow. I'm not going to predispose or bias the discussions that occur tomorrow, but at a very high level, conceptually, that certainly seems like something that we could support, as long as there's no strings attached per se, and it's shared priorities.
Okay, so yeah, so let's talk about
contemplation.
Let's talk about that, because you raise an important point. You know, obviously there's some language that's happening here that's about positioning, but more fundamentally, what I really still want to understand is, if the federal government says, okay, we want more data from you, it seems like everybody's on board with that. But what if they say, we want check-ins, we want benchmarks, we want results? Are you prepared to submit to essentially criteria, like in a manner of speaking, I guess, be graded in a way by the federal government on your performance in all this?
Well, first of all, we do provide data right now and benchmarks right now through CIHI. You can, any Canadian can go on the website right now and see how any province is doing with respect to cataract surgery, knee replacement, hip replacements, hip fractures. That data is being shared currently, and you can see how every province is doing relative to each other and relative to agreed upon national benchmarks. I do think what's important is that there isn't a jurisdictional creep. And I don't get the sense from the federal government that they have the will, the agency, or the ability, frankly, to creep into the operations of a healthcare system, which are rightfully belong with the provinces. So that is the nuanced discussion that needs to occur with respect to these bilateral agreements, if you will. And presumably, the discussion has been public that they will be largely set out through shared priorities. And for us in Newfoundland and Labrador, and thematically across the country, presumably they're very similar. Whether that's in access to primary care, surgical wait lists, long-term care, mental health and addictions, and others.
Now, you're about to go into this meeting with all your provincial and territorial counterparts. I saw one piece of analysis that pointed out that you are the only Liberal in the room. And that if the federal government wanted to sort of peel
I'm the only
somebody
doctor
away,
in the room too, Catherine.
I imagine that has its advantages. Although, anyway. I'm wondering, though, if there's an idea of like that there are some getting people on a different page, that if the federal government is sort of going to break some provinces away, that you would be sort of a natural focus of their attention. What do you think about that?
Well, the premiers have been largely united to date. I do think that in the past 2 years, for whatever reason, the rhetoric has heated up to a point where really it's caused a divide that wasn't really there to begin with. I think there's always been discussions about the quantum, but I think there's always been a willingness to discuss shared priorities. So interested to see how that dynamic plays out at the table, at the big table, of course. But I don't see the federal government trying to cannibalize individual provinces or jurisdictions. There's no question that I have more in common, of course, with respect to the demographic challenges, the geographic challenges, the historical challenges, and the complexity associated with those challenges in delivering healthcare services with some of my Atlantic colleagues. For example, our demographics, Catherine, in the 1960s, when our healthcare system kind of originated in Newfoundland and Labrador, there was 6 children for every senior. Right now, there's 2 seniors for every child. The system needs to be modernized. The demographics are such, and the complexity of that is very difficult for us as a province to fully assume. And so there are definitely some different priorities that are shared differently amongst different areas of the country, and I can't see the Prime Minister wanting to cannibalize one province over the other.
Help me understand, though, I mean, how much room is there for back and forth here? I've heard some of your colleagues say, yeah, sure, we want that. What the premiers are saying is 35% of healthcare spending. We won't sort of dig down into the details of that because I know the federal government would quibble with the 22% to 35%. But they're saying this is the amount we want. But I've heard some of your colleagues say, like, listen, I don't really have a red line going into this. So I would truly like to understand how much ability do you folks have to push versus just entertaining what's put on the table and sort of negotiating in the margins?
Well, first of all, let me say that to your first point about the quibbling about the back and forth on the quantum, from my experience in practicing medicine, still practice, not once has someone asked who's paying for this and what the percentage is. Is this largely funded by the federal government or the provincial government? That just doesn't exist. There's only one patient and there's only one taxpayer. And Canadians rightfully expect us to be collaborative as leaders in approaching a solution-oriented approach towards modernizing this healthcare system. So that's the position that we're going in with. We want to be open-minded. We want to be collaborative. I don't think it needs to be adversarial. I do think will be an opportunity to have some give and take within those bilateral agreements, if you will. But I'm interested to see. I'm not going to predispose or bias tomorrow's discussions because I frankly don't know what the proposition is. But certainly excited to be here, and I think it's a good gesture that we're all here. It's one that shows collaboration across jurisdictions.
I think it's very kind of you to say you're excited to be in Ottawa in February, sir. But before I let you go, I just want to sneak in one more question, which is about the timeline in all of this. We know, we've heard from premiers, we've heard from the Prime Minister. Don't expect that anything's going to be signed on Tuesday. You talk about the urgency of this. The other premiers do too. What should Canadians expect in terms of a timeline of when we're actually going to see some signed deals here, be they bilateral or health transfers?
Yeah, what I would see as a successful outcome of tomorrow's meetings is if we agreed at least on the framework and the concept, conceptually, if it's 2 buckets or 1 quantum and how it's divided between the CHT increase and the bilats, and then let us go and discuss with our respective colleagues at home potentially or between governments about how we negotiate the actual details of the bilateral agreement and agreements, perhaps plural. And I think that can happen very quickly. Like I know in Newfoundland and Labrador, we already have a plan. So we already have some structural elements available to us, some research done, where we'd be able to execute on shared priorities very quickly. Because I know our shared priorities are very consistent with the federal government and arguably Canadians from coast to coast to coast.
Okay, we're going to leave it there. We appreciate you taking the time to talk to us on the way in, Premier Furey. Thank you.
No problem.
Well, the premiers are in Ottawa tonight and just about to go behind closed doors ahead of their health care meeting tomorrow with the Prime Minister. PEI Premier Dennis King has stopped by our camera just before the meeting. We appreciate you squeezing us in, Premier. Thank you.
Oh, glad to be with you, Catherine. Thanks for having me.
Very glad. Listen, one thing that we were discussing on the show just a little while ago was the idea that given that you're only going to get 2 hours with the Prime Minister tomorrow, you can't necessarily, I'd love your take, call it a negotiation. It's really just a briefing. You think that's a fair summary of what's really going to happen in Ottawa?
I'm not sure we need to argue over the words and the meanings of what the purpose of the meeting is. I continue to look at it from the perspective, I've been at the table now for almost 4 years. We've been asking the Prime Minister to come to the table with more money. He seems to be in that headspace, so I'm excited to see that. And as premiers, as you know, we've been asking the Prime Minister to sit down with us to discuss how we can move forward in terms of improving healthcare. So I'll take the optimistic view on that for now, and we can argue over the details, I suppose, in the days ahead. But I think it's a good sign that we're here.
So tomorrow you're going to learn what this dollar figure is. Certainly that's our understanding. The Prime Minister, I remember being at his news conference as the cabinet retreat was wrapping up in Hamilton just a few days ago, where he was saying, you know, we think we have a very reasonable number to put on the table. If that number is not big enough, what can you do at this stage of the game?
Again, I think I prefer just to look at it from the perspective of, I know when I talk to Islanders from tip to tip, and I'm sure it's the same for Canadians, I don't think they really care much to talk about tax points or percentages. I think really what they want to do is to have the provincial governments work with the federal government to begin to rebuild and retool and improve the healthcare delivery service for our citizens. So that's what I'm here to do. We've had, I believe, a willing partner all along when it comes to federal relations, at least in my time here. I think we need to improve the system of healthcare delivery across Canada. I know we need to do that in PEI. The federal government comes to the table with more money. That's important, but it's not just money. We need a whole lot more when it comes to improving the system. And I think tomorrow, will be a good start toward that. And I think, but the hard work remains.
Now, Health Minister Duclos, Federal Health Minister, likes to say that as well. But I guess I'd like to push back a little bit. While I take the point, you know, we're all users of the healthcare system. You're right. We just want the system to work. We're not so concerned about where the money comes from. But you need enough money to make the kinds of changes that you're hoping to make in your healthcare system. So surely you're not saying that the dollar amount doesn't matter.
No, absolutely not. And I think, but I think that's where the conversation needs to go beyond just money. It's not just money. I've been saying it for months and years in PEI. It isn't about politics and it isn't about money. It's about transforming the system. We need people within the system to be able to do more. And if they're going to do more, we have to be able to pay them more. We have to bring in some innovations of how we deliver healthcare, where we deliver it, you know, in the system. We're on the way to that in PEI. We'll have 14 patient medical homes by the end of March, where you know, I think that's a collaborative delivery model, which I think puts us at probably at the top in terms of how we move forward with this in Canada. And Minister Duclos was in PEI last week, and he talked about how innovative and how creative and how far advanced we are in changing the healthcare system in PEI. So you know, it's not just about money; it's about changing attitudes as well. But it's putting the patient first, and I think that's what Canadians want. I know that's what Islanders want, and that's what I'm trying to give them.
Help me understand, does every Premier need to be on the same page going into that meeting with the Prime Minister tomorrow?
Look, that's an interesting question, and many people ask it. I know when I worked for former Premier Binns years ago, when we were negotiating with Prime Minister Chrétien and Martin and then Harper, it's hard to get agreement on anything across the table. I think generally in principle, all premiers would want some kind of fundamental plan of how we move forward, but each province is so unique and so different that I'm going to do things differently than they do in Alberta or British Columbia. That's just the reality of Canada and you know, across the board. So I think we have agreement in general principle of how we move forward, but we'll always have different viewpoints when it comes to what we want to do in each individual jurisdiction. And I think that's the beauty of this federation we have.
I wonder, we were speaking with the head of the Canadian Medical Association, Dr. Alika Lafontaine, and he was saying one thing he thinks should be in a condition in all of this is that all the money has to be spent on health care. What do you make of that proposal?
Look, I would agree 100% on that. I think that, you know, in PEI, if, you know, to use some rough numbers, if our overall operating budget is $2 billion, $1 billion of that goes to healthcare, we'll probably be in the vicinity of a 12% increase in the upcoming fiscal year in terms of spend. So I think we have to make sure whatever money comes forward from the federal government goes toward the delivery of healthcare service. That's the help I've been asking for. That's the help Islanders have been asking for. That's the help premiers have been asking for, and I think we just have to move forward, with that in mind.
Dr. Lafontaine was saying, much like you're saying, that it isn't just about money. It's about like some pretty transformative change in the healthcare system. Do you think that the Canadians are going to see that? I know it's difficult to speak outside the confines of your own province, but do you believe that's the moment that we're at?
Look, I think the challenge we face, quite honestly, and I've been saying this in PEI for a number of months and years now, is that the changes that we need to make are many, they're vast. It's going to take a total change in attitude and expectation of what we're able to do, where we're able to do it, and how we do it. The challenge we face is that we live in a world where everything is one click away and one swipe away. So I think Islanders would expect that we could just come in and fix something that's been breaking or has now broken from 30 or 35 years, and that's difficult, but it's going to take some difficult planning. It's going to take a change in attitude. I think Islanders, in my mind, from what I have seen, Islanders are so far ahead of politicians on this. They are saying, I know the system needs to change. Please tell me what it's changing to so I can get the healthcare service when I need it.
Tell me, we've been talking about the situation in various provinces, I think, of Nova Scotia, and these two terrible stories of women who sought care in emergency rooms and ultimately ended up dying, one in the emergency room, one after deciding to leave and going home. Tell me about the pressure that you feel as a political leader in your province when the stakes are so high, the system is struggling, and people's lives are literally on the line.
Yeah, I think that's any person in leadership deals with that pressure. It's hard to really explain the pressure, but you feel it every day, you carry it with you. But I'm concerned more with the people who do this every day, who are working extra hours, who are providing that extra care and attention and going above and beyond what they need to do. I want to be able to give them as much help as I can possibly give them. If it takes money, if it takes change in how we deliver that service, that's what I want to do. That's what I want to use my position and leadership to do. But yeah, anything when it comes to the loss of life or someone being hurt, when you're in a leadership position, Catherine, you carry all that with you, and it's a heavy responsibility, but that's the job we've signed up for, and I'm trying to make it a little bit better every day, and that will always be my focus.
In closing, sir, just a timeline looking forward. How we know that we expect that there's not going to be anything signed tomorrow. How quickly would you tell folks in your province that you hope to actually have something on paper that is signed, that there's an agreement that you can move forward on?
Yeah, I think time is important. I think we need to make sure that we can plan this going forward. So the sooner we know what the amount of money is, how it's going to be spread out, what the escalator will be each year, that will be important. But when it comes down to it, though, the real work begins, and continues, I guess, but it begins after we find out what that money is, how we spend the money, where we put it, and how we continue to innovate the system, how we continue to make changes that need to be made, and that's a long, arduous journey. I think we're on it. I think we're ahead of the game in Prince Edward Island in many regards. We have a lot of work to do, but I think having some consistent federal funding going forward will mean a lot for us, and it will make the job just a little bit easier. And I think that's what I hope to leave Ottawa with when we finish.
Yeah, well, listen, Premier, I think all Canadians wish all of the premiers well when it comes to making improvements in the healthcare system. We thank you for making time tonight as you head into this meeting.
Really appreciate the opportunity to speak with you. Thank you, Catherine.
That was PEI Premier Dennis King. So, what should be in this new healthcare deal? Dr. Alika Lafontaine is the president of the Canadian Medical Association, representing Canada's doctors. Dr. Lafontaine, the Canadian Medical Association has said that the healthcare system is broken. How important is what's happening right now, these meetings between the premiers and with the Prime Minister? How important is that towards fixing it?
We all remember what happened in November when talks between health ministers fell apart. I think I'm cautiously optimistic that things will change moving forward, but I think what I'm really interested in is the content of what's going to be focused on. What we do is more important than anything else that we're talking about right now.
So should I understand from that you're saying it's not about the dollar figure, it's about what kind of fixes for the healthcare system come out of this, or is this not the space for that?
What we've done in previous years is pour more money into a system that produces outcomes that really aren't what we need. And my big concern is that we might be doing that again if we don't determine what we're going to do different. And so seeing whether or not the federal government, the provinces and the territories are going to come out with a decisive statement saying we are going to focus on these things that can transform the healthcare system, I think that's really what physicians and patients across the country are really looking for.
Okay, I want to break down some of these steps. I do want to keep talking about money for a minute, and then we'll talk about some of the changes. Your group has said increase health transfers. As far as I can tell, you haven't put a figure on that, and I don't want to get too bogged down in the process, but we know the provinces, hey, it's only 22%. We want to see it go up to 35. The federal government would dispute that number, but is 35 the target? I appreciate that other things need to happen, but money is part of the solution.
Yeah, absolutely. So what do we know? We know for sure that we need more. Now, the big reason why we haven't focused on dollar amounts is because provinces actually can move forward with a lot of these changes already without waiting for the federal government. And so it's important for Canadians to know that we can move forward with healthcare change without necessarily agreeing on that number. What's important is that we move forward as fast as possible.
Should those changes be tied to the amount of money? I mean, I heard my colleague Rosemary Barton interviewing Alberta's finance minister, who said, listen, health, it's a provincial jurisdiction, no strings attached. Is that something that the CMA is on side with, off side with?
You know, I think the opinions of Canadians have evolved over the past few years. One thing that has to be within the conditions is that this is actually spent on health. The idea that Canada Health transfers end up going just to a general revenue fund to be spent any way that a province or territory wants to spend it, it doesn't make a lot of sense, especially when they're in the midst of the worst healthcare collapse that we've ever had in the history of our healthcare systems.
Very strong language there that I do want to take note of. I guess given that serious a state of affairs, is it enough to just say you have to spend this on healthcare, or would you support the federal government saying not only do you have to spend it on healthcare, you have to hire X number of new primary care physicians, or wait times have to be such and such? Like, should there be specific benchmarks, or is that federal overreach?
You know, I think in these discussions, especially if they migrate towards bilateral agreements, there will be a migration from the necessary to the achievable. So what do we know is necessary in the healthcare system? We have to make it easier for people to travel from one jurisdiction to another. Pan-Canadian licensure is something that we have to eventually achieve, whether that's piecemeal or altogether. We need to move towards team-based care. We need to find a way to take the people who are currently working in the system, take non-clinical burdens off of their shoulders, distribute it across the team.
So just for folks at home, what you're saying is things like not having family doctors who are in such great demand be spending hours and hours doing paperwork, that kind of thing?
Yeah, absolutely. That's one part of it, but also enabling those family doctors to work within a team. You know, what's often happening in provinces and territories is we're calling team-based care simply switching out the family doc with another provider. That's siloed care. Yeah. You know, we have to migrate to this new team-based care, and we have to improve healthy working environments. You know, we've had recent things talked about with private and public healthcare. And you know, the reason why private healthcare often has an easier time recruiting healthcare professionals is because it's just a better place to work. And so we can invest in our public systems, you know, repair working environments to make them good again. One
of the things that the federal NDP has been calling for here in Ottawa, they've really been sounding the alarm about the idea of creeping privatization, even if it is still this, you know, you're paying with your health card. They're saying that the federal government should get its hands dirty in all of this, and I don't know if perhaps Mr. Singh wouldn't approve of that language, but there you go, that it should get engaged at least and say that this money cannot be spent on any further private delivery. Where does the Canadian Medical Association stand on that?
You know, I think it's a discussion that Canadians want us to have. It is a conversation that I think physicians want to have as well. What's really important for Canadians to realize, though, is that private care is not a solution, it's a tool. You know, when you look at these private healthcare facilities, they're not focused on the really complicated types of surgeries. We're not talking about taking out, you know, bowel cancer. We're talking about doing quick in and out type surgeries. They will likely never evolve beyond that because that is just not what those types of facilities are designed for. So how can we have an actual discussion about how to repair our system? And the CMA's stance on public versus private is that we should focus on fixing our public system. That is really what's going to provide most value to Canadians.
So it sounds to me like you're saying you would not encourage politicians to make that kind of a make or break issue in these talks.
I think when you're looking at the necessary, what's necessary again? It's moving towards freer mobility for patients. It's making sure that we move towards team-based care. It's about healthy working environments. These are the ways that we're going to fix healthcare. I think the public versus private debate takes us into an ideological zone that doesn't really move things forward for Canadians.
Fair enough. The Prime Minister has said they're not going to be signing a deal, or deals, we should say, because we know there's the health transfer, the bilateral deals. They won't be signing deals at this meeting on Tuesday. How much time would you say to the political leaders that they have to get these issues sorted out?
You know, I think as people are in the midst of a crisis, and once again, we are in the worst crisis that Canadian healthcare has ever been in, people get used to it. You know, people get used to the chaos and crisis that surrounds them. And what's happening right now? More than 6 million Canadians don't have access to a family physician. You know, many people are showing up to emergency rooms and not receiving care. We have reports of persons who are dying, waiting in emergency rooms while trying to get assessed. You know, these things are just a sliver of what's actually going on in the healthcare system. You know, the hard conversations that we need to have is how are we going to fix those problems? How are we going to fix access for patients? And for providers, how are we going to create healthy working environments again?
We keep hearing optimism from all the parties as they get around the table. But again, given the gravity of what you're describing, does it sound to you like the politicians are really ready to make the kinds of changes that you're calling for?
You know, I think that politicians do their job in the political realm well. You know, there is a long tail to change, as we all know. That being said, I think their world is a bit separated from what's actually going on the ground. You know, I get calls daily from providers who are considering pulling back from practice or quitting practice entirely. And the reason why is because they see the pain and suffering that's happening with patients across this country. And so, you know, how do we get those experiences in front of politicians so they can be motivated beyond what they're motivated by right now? That way they can make these decisions faster. You know, that's the real challenge for Canadians right now.
Just before I let you go, what do you say to those doctors when they tell you that they've had enough, they don't think they can keep doing it?
You know, I say to those doctors, hold out for a little bit longer, but sooner or later, that hopelessness is going to turn into indifference, and at that point, we're going to have a whole different set of problems.
Okay. Dr. Alika Lafontaine, thank you so much for putting this all in perspective for us.
Thanks for having me.